Hi, all. Welcome back. This set of lectures is going to be on the respiratory system. So we'll spend a little bit time reviewing kind of the anatomy. Most of that anatomy is viewed and discussed in lab, but some of it we have to talk about in order to talk about the physiology. Before we dive into it, I just want to talk briefly about kind of a disorder, disease that is a recessive genetic disease called cystic fibrosis. Cystic fibrosis occurs. It can have multiple effects, but one of the main effects is in the lungs. And what occurs is an overproduction of mucus will occur in the respiratory tracts. Right? And this mucus is thicker. It has less water base to it, so it's harder to clear. It also, because it's thicker and harder to clear, it traps bacteria and you can't clear the bacteria like you would normally. So most of the mucus that you create in the respiratory system, the idea is to capture foreign material, bacteria, pollen, dust, whatever it might be, and then push all that material to a region where it can be digested. Okay, and that is it pushes it down your esophagus and into your stomach and you digest it. Or in some cases, I guess it pushes it out. So, like a runny nose or like coughing up phlegm. But for the most part, the normal process is for you to swallow the material and your digestive tract does the rest. Your stomach does the rest, it destroys the material. But when it becomes thick like this, then the bacteria can just sit there and the bacteria can breed and cause damage to the cells and deteriorate and create toxins and things like that. And over time, it deteriorates the lung tissue and the lung tissue starts to die off. And it used to be that kind of the best way to kind of combat this was to get a lung transplant. And lung transplant, of course, is a very invasive procedure. You have to have donors that have, good lungs, etc. And it, like lots of individuals died from cystic fibrosis because they didn't have the capabilities of lung transplants or treating this. Well, modern medicine has kind of caught up, and in fact, there's some miracle drugs out there now that seems to be able to decrease the amount of mucus laid down and really extend the life expectancy of individuals with cystic fibrosis. And if we have time, I'll discuss a few of those in greater detail and kind of the role that they play and what they do for individuals with cystic fibrosis. All right, so first off, let's talk about the anatomy real quick. Again, the anatomy we've covered in labs before, so it's just going to be a quick overview of the anatomy. But the respiratory system is typically divided into two tracts. Okay, and one of those tracts is called the upper respiratory tract, and that includes the nose, the nasal, sinuses, pharynx, and larynx. Often, if you hear someone has a upper respiratory tract infection, okay, they're talking about the nose, nasal cavity, sinuses, many times the sinuses, and so they'll have an infection in those regions. The lower respiratory tract, if you have a lower respiratory tract infection, then it's normally related to the bronchial tree or the lungs, typically the lungs, but that consists of the trachea, bronchial tree, and lungs. All right, let's look at kind of the nose real quick. Simple. We've already talked about this structure quite a bit. Okay, the nostrils are the external nares. That's what provides the openings for air to travel into the nasal cavity. Okay, it's all that nasal cavity is protected by hairs in the nose to catch particles and trap those particles in kind of a mucus layer, and then we'll kind of talk about how those little teeny cilia and hair-like structures continuously force the material to the back of the nasal cavity so you can get rid of it. So the nasal cavity itself is a hollow space behind the fleshy part of the nose. And this would consist of some conchae, nasal conchae, which are turbinate bones, very thin bones that are curled, and a nasal septum, which really kind of distinguishes the left side and the right side of the nasal cavity. And just other things that kind of separate passages and really make regions where you can trap particles from outside. You can clean the air passage. So the idea with the nasal cavity in the nose is this is one of the ways that air gets into the respiratory system, but that air needs to be as clean as possible. Okay, devoid of debris, dirt, whatever it might be, as many viruses, bacteria, etc., not being established in that air will make it so the lungs are not fighting off bacterial infections and things like that. You don't want that material in the lungs because the lungs are fleshy material that can be damaged fairly easy. And there's lots of blood flow and lots high oxygen levels there, so you could have high amount of reproduction from foreign or pathogens. And then, of course, the upper portion has a different purpose, and we talked about this when we talked about sensory organs, but the upper portion of the nasal cavity is related to the olfactory receptors, or the sense of smell. Okay, the workhorses, or I would say what's kind of the most important pieces of the nasal cavity is really the pseudostratified ciliated epithelium, or the mucous membranes. Okay, and so those specialized epithelial cells, they have cilia, okay, hair-like projections, okay, and they have goblet cells, and so these goblet cells are releasing mucus. That mucus captures things like dust, bacteria, viruses, whatever, pollen, anything that's floating around in the air. Okay, it captures it, and then that cilia pushes it, and it pushes those like packages of mucus and whatever the pathogen and dust and whatever it might be, pushes it, and it just keeps pushing it towards the pharynx, and then you swallow it. Okay, and once it makes it to the stomach, it's destroyed. Okay, and that really prevents infections from the respiratory tract. Okay, so a super important piece of the respiratory kind of system is the protection of the system, and that's really where the nasal cavity comes into play. So we can kind of look at this. So nostril, nose, okay, area, and then you have this nasal cavity. And if we kind of blow up what that nasal cavity looks like, a lot of the surfaces will look like this. You have these ciliated cells, okay, so these epithelial cells that have cilia, hair-like projections, and then space kind of in between those cells are goblet cells, and these are going to produce mucus. Okay, and that mucus will then just capture things, and then it can be pushed out of the way towards the back of the throat, and then you can swallow it, and it can go down through the esophagus to the stomach. Okay, another part of that upper respiratory tract is the sinuses, okay, or the paranasal sinuses. And these are areas that are filled with air, And so they're often what we would call open spaces. And so they occur in different bones, okay, the maxillary, the frontal, the ethmoid bone, okay, it occurs in the bone. And there are different hypotheses on why it occurs, but one of the reasons we think it occurs is because it makes the bone lighter. So it makes the head itself lighter. And so by doing that, it puts less pressure on the bones underneath and the muscles, etc. And so it's a benefit. Now, are there other reasons for it? Yeah, potentially. Like it radiates sound. It potentially could have housed beneficial bacteria and things like that. But again, um, the the purpose of them um, could be lots of reasons, but some of the main reasons are like the weight of the skull is reduced by not having solid bone. Okay, it resonates the voice, probably a secondary adaptation or a secondary kind of component to that weight of the skull. So when you talk, the air vibrations will hit the sinuses and then create a different kind of sound. This is why, like, if you have a sinus infection and you have fluid that's built up in the sinuses, it changes the sound that you produce, like via your voice. And so, like, we know that there's an importance behind the resonance of voice. Sinusitis is this buildup of fluid, sorry, that occurs in the sinuses, and you can have swelling, which prevents that fluid from draining. Okay, and then like in copulation with that, you could have bacteria that's in there that then starts to breed and deteriorate some of the epithelium cells, the lining. Um, yeah, and you get a change in pressure. So that pressure could relate to what we call sinus headaches, which are related to an infection or sinusitis that that buildup of fluid occurring in the sinuses. So we can look at a few of them. Okay, the main ones, the sphenoid sinus, okay, the frontal sinus, often individuals who have like what they'll often say is they have a head cold. Okay, that means they often will have fluid in the frontal sinus that's built up, and that kind of gives them that headache, that pressure increases in that region. Ethmoid sinuses, maxillary sinuses will often be associated sometimes with dental work. Okay, so if you have dental infection, sometimes it'll spill over into the maxillary sinus, and the top portion of the jaw will be in pressure and have lots of pain, etc. And there are just ways at which you can look at this through CT scans and X-rays and things like that. You can see the sinuses having fluid in the sinus. Okay, so this frontal here, you can see the fluid build up. You can see some fluid and some compression or the volume or the space, the airspace that's there is decreased with the amount of fluid and inflammation that's occurring in that. And then you can see through like a CT scan, you can see severe sinus infections will often have a bacterial component to it. And one way to see that is often you'll see air bubbles. So in like this case, you can see these air bubbles have formed, and that just indicates that there's living organisms in that compartment that are probably going through cellular respiration or at least fermentation, and they're producing carbon dioxide. And so those organisms are living and breeding in there, and probably need to treat it with an antibiotic. Okay, real quick, we've talked about cigarette smoking before, but cigarette smoking and its effect on the respiratory system is well documented, and so we can cover a little bit more about kind of what is going on with cigarette smoking. I think I discussed this before, but if not, kind of here it is again. There's estimates, and there's lots of different estimates, but like a single cigarette probably has close to 600 different chemicals or so. Um, it, so there's a lot of chemicals that we don't know their effects on the respiratory system. But apart from that, when the cigarette is lit or combust, it instead of having 600 different chemicals, now we're talking 6,000 to 7,000 different chemicals can be part of that combustion. And that just increases the likelihood that you're going to have some adverse effects of those chemicals on living tissue. Some of those chemicals have been known to paralyze the cilia. Okay, so those little teeny hairs that are occur in the nasal cavity, okay, and the respiratory system will get, it's not just the nasal cavity, but those become paralyzed, so they can't move anymore. So you can't clear the mucus that's being produced, that's capturing bacteria and viruses and dust and the other things. You just can't clear it, and the only way that you can clear it is by that well-known smoker's cough. And so when you hear that constant coughing, smoker's cough, kind of sounds like a dry cough, and then material comes up. And that is an individual that often the cilia are not working. Okay, they're paralyzed. And so in order to get rid of that mucus, okay, you have to cough it up. And so either cough it up and swallow it, or whatnot. But often because the cilia aren't working and there's stimulation to produce more mucus for protection, so you have excess mucus being produced, cilia aren't clearing it, and the way that you get rid of it would be coughing it up. Okay. And if this doesn't work, okay, if you're not able to clear it and cough it up, then the pathogens, the bacteria, viruses, they sit there in the mucus, and sometimes it can be a very nutrient-rich mucus, and that can just cause infections to occur in that region. Right? And over time, that constant coughing, that inability to clear, that constant amount of bacteria and other pathogens sitting in that mucus can eventually cause chronic bronchitis or chronic inflammation of the bronchi. Okay, so the bronchiole thickens then due to that. Okay, so you can get this thickening of the bronchial walls, and then when that occurs, normally what you would see is it's like plaque building up in the arteries. Same kind of premise, right? You thicken your walls, and the diameter or the volume of air that can now travel through that bronchial is less. And so it's like you're permanently constricting the bronchial. And that's where we get into things like emphysema. You get into bronchitis and other things, because eventually, if you're permanently constricting that area, less air is able to go into the alveolar sacs or through the alveolar wall, and then that can lead to scarring of the wall or emphysema. And now, instead of having the ability for oxygen to move across a single layer of cells, now you have scar tissue where there's no transfer of oxygen in that region. Okay? The other thing that can happen, and often does happen, is before you get down into, or while you're kind of moving into the bronchitis, emphysema stages, etc. Okay, a lot of those cells that are being paralyzed and damaged, they start to die, and they have to be replaced. And when you're replacing cells anywhere in your body, if you're constantly replacing cells over and over and over again, okay, some of those cells may develop mutations. And some of those mutations, it only really takes one. If that mutation's able to bypass the cell checkpoints, okay, which you probably should have learned about in 160, if it's able to bypass those cell checkpoints, it becomes cancerous. And that means that that cell can grow continuously. It doesn't have a checkpoint, nothing's stopping it from growing. And this is where, that connection between cigarette smoking and lung cancer comes into play. So about 20% of smokers develop lung cancer. At least that's the current data. And I mean, a lot of people might say, well, I thought it would be higher. But again, your body is very good at correcting mistakes. And so on average, based on plenty of research, with things like mice and whatnot, we know that about 15 cigarettes, or about a pack, let's just say a pack a day, a pack of cigarettes, and you'll accumulate or develop one DNA mutation. Okay, so smoke 20 cigarettes or whatever, and you develop a DNA mutation. Okay. Of those mutations, though, most of them are fixed. Okay, so you have a very good proofreading system in your body. Okay, and one of those proofreading proteins is called P53. It'll go through and it looks for mistakes in the DNA code. Okay? And when it finds those mistakes in that DNA code, it fixes them. So about 99.9% of mutations are fixed, they're repaired. But if you're smoking 15 or so cigarettes every day, you're developing a mutation every single day, eventually you're going to hit, at least 20% of the time, you're going to hit that 0.1% where that mutation is not repaired. And that's where that tumor will start to develop. And that kind of brings us into, normal versus cancerous lungs. Normal, this kind of pink tissue, maybe a little bit of scars here and there that occur in the tissue just from wear and tear, just from, normal cell death, etc., but nothing compared to like the lung tissue of an individual who has a cancerous tumor, but a smoker's lung tissue. And so you get these black necrosis regions will often be like accumulation of dead cells in the alveoli are dying. You'll get these open spots where a lot of the cells have died in that region and there's no transfer of oxygen or CO2. And then of course, if it's cancerous, then there's a tumor that will develop, uncontrolled cell growth in a certain region. Well, lots of blood flow going to this region to feed those cells. But that tumor will develop. And then that can metastasize and be sent out through the blood system to different regions of the body. And so it can be more than just the respiratory system that's affected. All right, let's dive into the pharynx real quick. So the pharynx is just that open passage by the nasal cavity. And so it's just the area where food and air can travel. It does aid in sound production, changes the kind of production of one's vibrations. And so that can alter that. Three main areas: the nasal pharynx, the oral pharynx, and the laryngeal pharynx. Just different regions. It's just breaking it up into different kind of regions that you might have different components to it a little bit. But again, we're not going to dive too much into um, the anatomy because we've already talked about it. Okay, the larynx itself, this is normally what people call the voice box, because this is where the vocal cords, both false and true vocal cords, are held. Okay, there's a lot of muscles and cartilage associated with this region because there's a little bit of movement that's going on in this region. This is kind of that connection piece between the upper respiratory tract and the lower respiratory tract. This is kind of that connection between the two pieces of the respiratory tract. Cartilage, three major or large cartilaginous mechanisms, and that would be the Adam's apple or the thyroid cartilage. Okay, the difference mainly between males and females when it comes to Adam's apples, most of the time people know, like, and the Adam's apple, if you can see an Adam's apple, probably the individual has high testosterone levels, because that causes the thyroid to be more pointy. Okay, and then you can kind of see the projection. If they have low testosterone levels when developing, it'll typically be flat. This is not always the case, but men normally have that Adam's apple, which is kind of pointed, and females don't. Other things like the epiglottic flap, super important to prevent food from going down into the trachea. And so the epiglottis, when you swallow, that flap flips down, and we'll kind of show you kind of a diagram here in a second. And then there's three small cartilages, some that are related to the ability to kind of talk or at least make sounds, and so speech related. And like we'll cover a few of these when we talk about the actual vocal cords. Okay, so when we're talking about the vocal cords, we're talking about two kind of pairs of muscles and connective tissue that are related to each other. Okay, you have the false vocal cords, or sometimes called the fake vocal cords, vestibular folds. Okay, these don't produce sound, but rather these hold the true vocal cords in place, and so they help with closing off the glottis, but also help with stabilizing the true vocal cords. And the true vocal cords are folds that kind of run in the opposite direction of the false vocal cords. And they are part of that sound projection, and really it has to do with the vibrations or the ability to close the glottis, and the how much air is coming through the glottis. And so it's a combination of both the space that is open and the vibration of the cords themselves. Okay? And that's really what gives kind of the initial sound. Okay, the voice or the speech has to do with a lot of other components, has to do with how the tongue is positioned, has to do with the other portions of the respiratory tract, upper respiratory tract, even the sinuses and things like that will kind of give that distinct voice for someone. So here you can kind of see those false vocal cords. Okay, they're really component of muscle and connective tissue that stabilizes the true vocal cords. And then the true vocal cords are these cords that are part of closing off that opening, or the glottis. So the whole thing is typically referred to as the glottis, but that opening is controlled by those true vocal cords. And so when air passes through, it vibrates the true vocal cords, changes the amplitude and duration of the air that's traveling, gives you kind of different sound waves. And that's what generates the sound coming from the vocal cords. Individuals can manipulate their vocal cords. Okay, they can train their vocal cords to be able to close different regions and make different sounds by closing, different portions of the glottis, by releasing less air, more air, etc., in many different ways. Okay, along with the position of their tongue and other things can change their voice. So that, you know, kind of important from that perspective. And we can talk about other things that are associated with this. We've already talked about the thyroid gland, okay, also associated with this region, and whatnot.